Good evening, good evening. Robert here, coming to you live from East Africa. It's 8:23 p.m. So depending on where you are, good morning, good evening. Thank you for joining us. Last time we were talking about the silent killer, and we explained that the silent killer is not some person that is creeping up, stalking you, but it's simply high blood pressure, hypertension. That's the other name. And we talked about what is normal, and we specifically decided to focus on the complications, because if you can understand exactly why you're getting all these complications or why you have certain medical diagnoses, and those medical diagnoses sometimes they seem like they're different or something different is happening in your body, but it's actually as a result of the same thing. So they actually have the same source, if you like, or the same cause when we talk about these complications. The reasons why we want to make sure that you understand how these complications are related to high blood pressure, so you can be able to either control it, reverse it, or even prevent it if you don't have it, because it's something that most people can develop, and it's a major problem that is happening in the world, mostly in both developing and developed countries. Mostly on developed countries, but on developing countries, actually, it's a problem that is coming up as a result of sedentary lifestyle, how we are eating, and that's a major problem, because it's going to put a lot of pressure on people, on families. And if you can understand how blood pressure is preventable, or how it can be reversed, or how it can be controlled, then you don't have to get to these complications like last time we talked about congestive heart failure, or simply heart failure, which means simply that your heart has modified itself over time, or it has changed its shape as a result of high blood pressure. And as you can see on the slide here, one of them has the pink side is the muscles, and the other one, the muscles are bigger, and that's why I said you don't want to have a six-pack around your heart, and basically that makes your heart lose the inability to efficiently pump, and things start backing up in your lungs and your legs, and we described what are the symptoms that you will show up in. And you look at heart failure as a result of dilation. It's the same thing. The source is high blood pressure. And, so today we will go on to the next destination of this silent killer, and how high blood pressure kills you or can kill you, and we don't want it to get to that point, is bleeding. And if you notice, actually on the title here we put silent killer, bleeding. So how does high blood pressure get to a place whereby you have things, you have pipes, I call them pipes, blood vessels, I call them pipes, because you can visualize pipes, then pipes can burst or they can clog, and today we're talking about when they burst, they bleed. And when they start, when they burst as a result of high blood pressure in the brain, then we call that a stroke or hemorrhagic stroke. And there are certain technical terms or medical terminologies we're going to use, but what we are simply saying is that, especially when you're talking about subarachnoid hemorrhage or intracranial, intercerebral hemorrhage, you're talking about possibly as a result of pipes that got weaker for whatever reason. Maybe it's a defect that was always there, where you had a weakness along the pipes, and as a result of high blood pressure, these weaknesses start bulging and bulging and bulging, and eventually they rupture, as you see here. So was the problem the weakness? Yes, that was a problem, but the major problem was because of high blood pressure. So because the blood pressure, just like a balloon, if you ever inflate it, you put too much air, there's a maximum where you will actually have this balloon bursting on a tire, whether it's a bike or a car. The same thing. So if the blood pressure is too high, or you have hypertension or high blood pressure, then this could be happening, but you can prevent it, you can reverse it, you can control it by simply first knowing what is your blood pressure, to know whether you have that diagnosis, and knowing that that's actually not the issue. It's not the blood pressure. You see, we are all socialized to think anywhere in the world, if you're sick, you have to feel some pain. The problem with the silent killer, there is no pain. And when you're having some of these symptoms, it means that there are things that are happening internally, and they will develop emergencies. So if you're having, these pipes bursting in your brain, then you have a stroke. If they're bursting in the pipe that connects your heart to, through the big pipe that comes from your heart, called the aorta. And if you can see here on the screen, it's the pipe. It says normal aorta. It looks smooth and nice. But when you look at the bottom here, it is bulging. And when it's bulging, that basically means that you are at risk of having this burst as a result of high blood pressure. If you look at the same pipe coming from your heart to your to your abdomen, it's a very smooth pipe, but then it starts bulging. So it can bulge anywhere along that pipe, but it's bulging because of what? High blood pressure. And there could be so many other risks, but I want to focus on high blood pressure, that when you have high blood pressure, these are things that could be happening internally, and again, they are preventable, they are reversible, you can control them, but you have to know what is your blood pressure and what could happen. So because again, there's not going to be anything painful with high blood pressure. The other thing I want to focus on is dissection, and as the word says, it's like dissecting. So there's something that is dissecting your pipes. And if you think about the arteries, and they're made of 3 pipes in one. So there is the outer layer, the in layer, and the middle layer. And so when you have high blood pressure, if a tears happens, and you basically will have, if you focus on the slideshow here, basically those little particles you're seeing is blood flowing in one direction, and there is a tear that happens and tears the middle pipe, and the blood will be flowing between the inner pipe and the outer pipe. So basically it dissects or cuts and penetrates within that layer, and that's a medical emergency, again, as a result of what? High blood pressure. So again, if you understand how high blood pressure, if you go to this other slide, you will see how now everything is connected, and a picture is worth 1,000 words. So you see the heart and the pipe, the major pipe that connects the heart, the aorta, and here is in colors green, orange, and red. And when you're having a dissection, basically it means blood is not flowing within the lumen, the inside pipe, but it somehow penetrates, tears and penetrates between those 2 layers, and it is flowing within the middle layer. And the major things could happen, if there are clots that could form. There are so many things, because if blood is not flowing, because in this case it's flowing in the wrong place, it will start forming clots, it will start squeezing the pipe, so that blood pressure drops and there could be bleeding. I mean, so there's all these things that are happening, but they're happening again because of what? Because of high blood pressure. So again, it's important for you to understand how all these complications are connected to high blood pressure and how you can prevent them. So again, my advice is, do yourself a favor today and know what is your blood pressure. And if you have high blood pressure, that's not the end of the road. It means there are things you can do to control, and with your doctor, to control that blood pressure, so you don't have to have these complications. If it's normal, you don't have basically to do anything. But again, even if you're normal, it doesn't mean that you're permanently normal. There are things you could do that could raise your blood pressure, like eating too much salt or living a sedentary lifestyle, meaning you don't exercise, or the type of food that you're eating. So it's knowing where you're at. But if you're pre-hypertensive, meaning you're not normal, yet you're not described as having high blood pressure, that you actually can reverse that and bring back your blood pressure to normal by simply exercising, eating right, and those are very simple things to do. Again, the major things to know: if I don't do that, which the things to prevent, to control, reverse or prevent my blood pressure, basically the things that will internally, silently be happening in my body, and eventually those things will show up. And when they show up, they are medical emergencies for the most time. And for the most part, there are things you cannot reverse, and so they are permanent. So you are either, they either kill you or they leave you permanently disabled. So those are things that you can do something about it. So we will stop there for now. We will continue on dealing with complications of high blood pressure as we move on. And if you like what we're doing here, you can look at a book on Amazon.com. It's by this author, Robert Mwangi, and it's called Dollar Out. Again, Thank you for watching.